maybe 5 seconds. Okay, all right, good morning, everybody. Welcome to Phlebotomy Credentials. Now what? On behalf of the Delaware Area Career Center, students and staff, I would like to welcome and extend our deepest gratitude to our guest speaker, Karen Burns from Ohio Health, for taking the time to meet with us today. We truly appreciate you having you here, and I don't want to waste any more time. I'm going to go ahead and turn the spotlight over to you, and so that you can give us some more information about yourself and your role at Ohio Health, and the next steps for students after phlebotomy class.
Okay, great. And everybody can hear me okay. Again, my name is Karen Burns. I am the Laboratory Fellowship Manager for Ohio Health Learning at Ohio Health. I just want to talk to everybody. I really appreciate everybody jumping on. I so wish I was there in person, that we were all in person. This is our new way of doing things. So definitely appreciate everybody jumping on this morning. A little bit about myself and my background is I'm a medical technologist. I started drawing blood when I was 17 years old and have always been more attracted to the blood drawing portion of the laboratory, but I enjoy the clinical side and the technology part as well. I have been a phlebotomy manager, phlebotomy director. I had an opportunity to build a fellowship program a couple years back, and have been doing the learning side since 2019 with education. So just a little bit about the Laboratory Fellowship Program at Ohio Health. We developed the program as a transitional program for people. Everybody who gets hired into Ohio Health comes through the fellowship program first. We do all laboratory onboarding and laboratory education together. And this is phlebotomist techs, anybody who is hired into Ohio Health Laboratories. And then after we do onboarding, we go into our phlebotomy and phlebotomy skills. So we're together through phlebotomy skills. We make sure everybody coming in feels comfortable with their skills, has the confidence, has everything that they need, all of their tools moving forward as they transition into their permanent job. So Ohio Health is very large. We have 12 hospitals. Every one of them has a laboratory, and we also have almost 60, 65 laboratories out in the communities where people just go to get their blood drawn close to home, and then we send all the specimens. So being a large system like that, a great piece about the fellowship is that it gives everyone opportunity to go out and see the different hospitals, to see the different laboratories, to go see Riverside, to see Grant, to see a smaller hospital like Dublin. We also have Grady in Delaware. So it's about finding that good fit, the good fit for the laboratory and the good fit for you. So we do that with phlebotomy as well. We look at inpatient, we look at outpatient, and give opportunity to you, the new associate coming in. So that's a little bit about the fellowship program. Everybody comes in, everybody we like to take our time up front with all new associates to make sure that your fit is good and that it's someplace that you can be successful and that you can enjoy. A little bit more about phlebotomy itself. I was lucky enough to help start and teach the first year of the phlebotomy program at DACC. We think that it is a great opportunity to get started in the career and to be learning. at that high school level. And then when you graduate, then you can move right into a phlebotomy job or phlebotomy position in any hospital. Of course, we're particular at Ohio Health with the ACC. It gives good opportunity to get to know you right from the start and try to help find that good spot for you. So you go through the phlebotomy program at DACC. I do understand that it is they're just about to start. I think they're starting next week, actually. You'll learn the phlebotomy basics, you'll learn the skills, and you'll go through that until you graduate. And then if you want to go into a phlebotomy position, then we work with you on the Ohio Health side to get you into a position and get you started and what that looks like. So all along, we are transitioning you and training you for a job in phlebotomy. So once you have your phlebotomy credentials and you have training, we in the state of Ohio do not require for our phlebotomists to be licensed or certified. So taking the certification is definitely a plus. It's a positive. It's great to be certified, but you can get a position without taking the certification. You need phlebotomy training, and then you come into the fellowship, and we continue your training and make sure that your skills are good and that your confidence levels are ready to go. So after that, I think that what I really want to highlight is the great part about Ohio Health is, especially on the learning side, is that going into phlebotomy is an awesome career. It can be a step program for you. It can be a career that you do for the rest of your life if you'd like. We offer a great deal of career development. We have different programs. We have Ed Assist that once you come in, you can work through Ed Assist, and they are specialized counselors that will talk with you about your career development, what direction you would like to go in, kind of get you situated. We also have a very nice tuition reimbursement program that after 6 months of employment, you can get tuition reimbursement to advance your career in any direction that you want to go. It doesn't have to be in the job that you're working right now. You can go into nursing, you can go into laboratory science, you can go into ultrasound, you can go into whatever degree you're more interested in. And Ohio Health will assist you in getting there. So Ohio Health is very, their culture is very strong, strongly wrapped around the associate and any career development that they can help with and help support you in. So it's coming in as a phlebotomist. It's gonna get you more experience and experience in the hospital setting. You can get experience in the outpatient setting. You're going to, have involvement and exposure into the laboratory. We also, I help develop, and I may be talking too fast, so I apologize. I help develop a scholarship program that we now have Scholar Dollars, and a scholarship program that everyone can apply for. If you're coming in as a phlebotomist, you can apply for scholarships. We gave away 8 scholarships last year for a crosswalk into the MLT program, the Med Lab Tech program. It's a 2-year program at Columbus State that is, if you get the scholarship, it is completely paid for by Ohio Health. And that is everything for your program, all 2 years of your program, all your costs, all your book costs, all your graduation costs, everything to help support our associates going into laboratory positions. So if that's anything that you're interested in, I'm more than happy to get you more information about it. It's a wonderful program. You can continue to work and as a phlebotomist while you go to school and have everything paid for. So we work with a lot of the schools. We would have academic partners, and we're academic partners with the Career Center that you're at right now. We also are academic partners with colleges, Columbus State, Otterbein, all of local area colleges in Ohio, and work with them to help kind of partner with clinical sites and being able to have clinical rotations and to add to those careers and support. So the whole idea is we want to make sure that we're working with you all the way through school, right now. We're working with you as you go to college, and that will help you have that familiarity with Ohio Health and come in as an associate and have your career and hopefully have your whole career at Ohio Health. So kind of back to the beginning of your phlebotomy credentials and where that can take you and what's next. I'm a huge advocate for phlebotomy. It's a hugely important job, taking care of patients and patient care. It's a great part of the laboratory. So once you have your phlebotomy and you have your phlebotomy credentials and you're moving forward, you're coming into the world of healthcare, where you can continue to grow. You can grow as a laboratory technician. You can get your 2-year degree. You can go and get your 4-year degree while working and while having benefits, and keep continuing to grow in your career. So what you can do, and just to back up a little bit about phlebotomy itself, and some of you may or may not kind of know what phlebotomy is all the way around. So we definitely want to make sure we will always need phlebotomists. You're going in your frontline patient care. You're drawing blood from patients, either inpatients or outpatients, and you will take your specimens and your samples back to the laboratory, process them, and send them off for testing. So to kind of crosswalk that a little bit, you will, between the phlebotomist and the lab tech, so the phlebotomist collects all the specimens, processes the specimens, hands them over to the lab tech, and the lab tech will run the test, and they are responsible for the instrumentation and doing all the testing and resulting back to the physician. So there's all different pieces and parts to the laboratory itself, and every situation is a career opportunity. So personally, I was in nursing. I started my career out in nursing and decided that nursing wasn't really for me. I had already been a phlebotomist. I liked the laboratory side of things a lot better. I had that scientific piece of me that really liked running the test and looking at the cells and being able to help physicians with diagnosis and getting patients to feel better. So it's all about what you want and where you want your career to go. If you feel like you have that scientific and you want to learn more and you like looking at cells and you like doing testing, then there's lots of opportunities on the laboratory side to get into, and definitely the laboratory will always need med techs and lab techs. So it's a great opportunity just to even with the phlebotomy piece, even getting into the laboratory and finding out what all the pieces and parts of the lab are, and being able to get in there and really see how the testing occurs. So with that, I know that I talked really, really fast. I think that I probably blew right through everything, but I want to make sure and hopefully that you guys have some questions for me. And if you have questions that you want to, either put in the chat, or if you want to reach out to me, I am happy to help support anybody who is thinking about going into phlebotomy or going into laboratory science. It's an awesome career, and I definitely hope that this will at least give you some tools and some information as to what you're looking for moving forward. Definitely, the lab fellowship is a great step. I think that putting a lot of information and putting a lot of effort around students who are graduating and new grads that are coming in, and this may be your first job, it may be your first full-time job. Sometimes it can get a little scary. So we want to be there to make sure that your transition is smooth and to make sure that you're transitioning and feeling comfortable and confident in your skills as you move forward. So if everybody who is on this call right now, if you were to go into phlebotomy, my job would be so much easier, because we definitely need phlebotomists. It's a great way to start. I hope that you guys can definitely see yourself. Can you guys hear me? Because I went on mute for some reason.
Yes,
Okay.
we can hear you now. Yes.
Did you hear me before? I hope you heard me
No,
before.
you were blocked out just a little bit.
Oh, the whole
Just
time?
no. For about 5-10 seconds.
Just 10 seconds. Okay.
Yeah.
So again, just to kind of recap with everybody, there's a lot of opportunities with phlebotomy. It's a great stepping stone. It's a great stepping stone into healthcare careers, all healthcare careers. It's a great way to be able to help patients. 79% of all laboratory or all patient diagnosis come from laboratory tests. So the laboratory is a really big piece of healthcare, and you can definitely have a lot of movement, a lot of room to grow, and a lot of different opportunities for you. So definitely, I hope that helped. If I can answer any questions, or if you want to talk further, please let me know. And I definitely appreciate you. I appreciate your time. I hope to see every one of you at Ohio Health down the line, and please look for me. Okay, now wait. I gotta